For more than 23 years, Faith Community Pharmacy has been a cornerstone in ensuring that everyone who lives in Northern Kentucky has access to quality health care. In that time, we provided hundreds of thousands of prescriptions worth millions of dollars to thousands of people. The work that the pharmacy has done throughout its time has saved thousands of lives and ensured that people have a chance to live healthier, happier, and to thrive. We are seeing our numbers grow every year. We grew by more than 20% last year, and we're on pace to grow by more than 20% this year. As things in the United States and our community continue to change, the need for our services is more important than ever. Friends and neighbors are losing access to health insurance, their premiums are going up, their co-pays are going up, and unfortunately, chronic disease is going up in our community as well. We are committed that we will continue to be here as an anchor point in our community, and we are committed that we are going to continue to be a cornerstone to ensure that everyone has access to quality of care.
It's amazing that we're almost 25 years into this pharmacy being founded, but the need just continues to grow and grow for people's everyday medicines, life-changing medicines that people are needing. It's just one of those things to where the more the word got out about the pharmacy, the more people we realized actually needed help. But it's like I said, people are having to make decisions between paying their rent or taking their medicine, and that choice unfortunately is still around, given all the changes that haven't happened yet that we would have hoped would have happened over the last 25 years administrative wise. But as the population changes and grows in the area, just the more and more people need this service that's being provided.
The exciting thing is we know that prescriptions aren't enough. We know that for somebody to come to the pharmacy, they have to have a script in hand first. And as things are changing in our community, getting that prescription is becoming harder and harder. Getting in to see a doctor, having insurance to be able to go, being able to cover the cost of that are getting more and more difficult. That's why we are so excited to announce to you first tonight that we will be opening Northern Kentucky's first full-time free clinic in March of 2026. With that, we hope to ensure that there is literally no one in our community that goes without access to quality care. We'll be changing our name. We're going to become the Faith Community Health Network. And under that network, we will start by having our Faith Community Pharmacy and our Faith Community Clinic. But we're excited that we're keeping it broad because we know that this need is going to continue to expand over time, and we want to be prepared to continue to step in to those needs when we see them. We believe that adding this clinic to our pharmacy and expanding the services of our pharmacy with it, we are going to be able to make an even bigger impact.
I have been a primary care physician in Northern Kentucky for over 25 years and have had the privilege since 2019 to be affiliated with UK College of Medicine's Northern Kentucky Regional Campus and became their Regional Dean in 2023. And as a result, I have been privy to wonderful opportunities, but also opportunities that have challenged me. And one of the greatest challenges I've experienced as a primary care physician and in leading these medical students has been how do we address the very significant real need of providing care for the underserved within our region. I grew up in Northern Kentucky, born and raised, and I've chosen to live here and raise my children. And so I have a huge heart for this region. And I feel that as physicians, we have an obligation not to just care for patients at the bedside, but to also address population health and areas of health disparity. And when I assumed the role of Dean of the College of Medicine here in Northern Kentucky, one of my tasks was to bring an opportunity for my students to participate in the care for the underserved. And as a result of that, we created something called Crew Clinic, which is a clinic that cares for the uninsured or underinsured in Northern Kentucky. And it's been a win-win situation, not only for the patients we care for, but also the students, because it's an opportunity to instill in students at a very formative age of their education this desire to care for the neediest among us and who have the least access to our health resources. And so One of the biggest struggles for me as being a provider, as a physician, and also leading these young physicians has been, we've only been able to do so much. And I've felt this need and this pull to extend what we're doing so that this is complete. Part of the struggle for me is, how do we provide a comprehensive approach to this need? And a comprehensive approach involves offering care for the underserved on a regular basis, on a full-time basis, because we know that they don't only get sick on Monday and Wednesday evenings when we're at the homeless shelter. They don't only get sick on Saturdays when we just so happen to be at the clinic in Florence. And so how can we offer full-time care for those who need us? In addition, we all know that the underserved population also has significant limitations. If you've ever done a poverty simulation, you know that poverty is a full-time job. It's not as easy as just handing someone a prescription for an antibiotic or a medication or a lab draw to say, go and have this done, because they don't have the transportation. They can't take off work to be able to go and have these things done, because they just got that job, and that job is going to keep the electricity on. It's going to put food on the table for their children. And so by being able to offer not only a clinic experience that's full-time, but that also offers accessibility to a pharmacy, and accessibility to having laboratory evaluation all in one stop, is a complete game changer. And the only way we can truly change the healthcare landscape of our region is to care for those who are the most destitute. And this is a way to take care of that particular problem.
I am very, very excited for the comprehensive clinic that we're going to offer in conjunction with Faith Pharmacy. I think so many of our patients come to us with lots of chronic diseases and lots of need for lab work, for prescriptions, and being able to say, I can check your blood glucose, I can hand you a 30-day supply of your hypertensive medication all in one clinic visit, and have them leave that clinic with the knowledge, both from our perspective and theirs, that we were actually able to help them in the way of being a pseudo primary care for them. And you know, having patients set up with primary care is so difficult as well. So this is really going to be such an incredible opportunity, both for students and physicians to understand kind of what a clinic takes in terms of all the different parts, but then also having patients leave with, you know, a full clinic visit, a full care of medication, lab work, and having seen a physician. So being a part of this clinic is really why I went to medical school. I find that working for the underserved is really a core tenet of what it means to be a physician, and I think that being able to offer this care and connect with community resources is something that is both a skill that we have to learn to be, you know, competent physicians, and also really is kind of what gets me up every day.
We recently held a clinic at a local nonprofit, and I had this patient who was a few years younger than myself. She had a child somewhat recently, and she was struggling postpartum. She had been seen at a different clinic and was started on a medication for anxiety, depression, but she was unable to get it refilled due to not being able to pay to go back to the clinic, as well as not being able to go pick up the prescription due to barriers in transportation. So when I think of this story, I think of the world a difference that it could make to have a clinic and a pharmacy in the same place. A free clinic, that is, so she doesn't have to worry about co-pays, so that she can make sure she has access to care, and then follow that up with a pharmacy in the same place so that we can give her a prescription that day to help her.
We hope that you'll choose to partner with us so that we can bring this dream into reality, and we can continue to make Northern Kentucky one of the best places to live for all of us.